So let's continue here in lungs and heart. So for the PA oblique projection and Rao and Lao position. So the patient's position must be, we need to maintain the patient in the position. It's either for standing or seated upright and used for the PA projection. Then we need to instruct the patient to let the arms hang free. Have the patient turn approximately 45 degrees toward the left side for and Lao position, and approximately 45 degrees toward the right side of an Rao position. Then we need to ask the patient to stand or sit straight. If the standing position is used, the weight of the patient's body must be equally distributed on the feet to prevent unwanted rotation. So for PA oblique projections, the side of the interest is generally the side farther from the IR. However, the lung close to the IR is also imaged. The top of the IR should be placed about 1 and 1/2 to 2 inches above the vertebral prominent because of the top of the shoulders may not be on the same plane. So we have here the central ray. So perpendicular we need to place the central ray perpendicular to the center of the IR, and the central ray should enter at the level of the T7. So here the part position, for the Lao position, we need to rotate the patient 45 degrees to place the left shoulder in the contact with the grid device and center the thorax to the IR. Then we need also to ensure that both the right and left sides of the body are positioned to the IR. And we need to instruct the patient to place the left hand on the hip with the palm outward. Then let's have the patient needs to raise the right arm to shoulder level and grasp the top of the vertical grid device for support, and adjust the patient's shoulder to lie in the same horizontal plane and instruct the patient to not rotate. Then we need to use a 55 to 60 degree oblique position when examination is performed for a cardiac arrest. So remember 55 to 60 degree oblique position when taking or when performing cardiac series. Then this projection is usually performed with barium contrast, and the patient swallows the barium just before the exposure. So for the Rao position, it's just reverse the previously described position, just placing the patient's right shoulder in the contact with the grid device and the right hand on the hip and the left hand on the top of the vertical grid. So here is the figures for the figure 10 to 43, PA oblique chest in a route position, and figure 10 to 44, PA oblique chest row position. So here are some for the next slide. Here's the structure shown for the PA oblique chest. The low position is 60 degrees with the barium filled esophagus. So the esophagus there is being enhanced by the barium sulfate. Then the row position is the maximum area of the left lung field, which is side farther from the IR, is demonstrated along the thoracic viscera. The anterior portion of the right lung is superimposed by the spinal, and superimposed by the spine, also known as the trachea, and and the entire left branch of the bronchial tree. This position gives the best image of the left atrium, the anterior portion of the apex of the left ventricle, and the right brachiocardioid space. When filled with barium, the esophagus is shown clearly in Rao and Lao position, as you can see here. Then the structure shown for low position, the maximum area of the right lung field, which is side farther from the IR, is demonstrated along the thoracic viscera. The anterior portion of the left lung is superimposed by the spine, also shown as the trachea and its bifurcation, which is the carina, and the entire right branch of the bronchial tree. The heart and the ascending aorta lying in the front of the spina and the arc of the aorta are also presented. So here the figure 10 to 45, it is a PA oblique chest in Lao position. So this is the last projection for the this is the last projection and position for the lungs and the heart AP oblique projection. So for the patient's position, with the patient supine or facing the X-ray tube, either upright or recumbent. Adjust the IR so that the upper border of the IR is about 1 and 1/2 to 2 inches above the vertebral prominence or about 5 inches above the jugular notch. Then, for the central ray, we need to place it perpendicular to the center of the IR at a level 3 inches above the jugular notch. And the central ray will exit at T7. So the body part that being positioned should be like this, and we need to rotate the patient toward the correct side. We need to adjust the body at a 45-degree angle and center the thorax to the grid. If the patient is recumbent, we need to support the elevated hip and arm, and we need to ensure that both sides of the chest are positioned to the IR. Then next, we need to flex the patient's elbow and place the hands on the hip with the palm facing outward or pronate the hand beside the hips. The arm closer to the IR may be raised as long as the shoulder is rotated anteriorly. We need to adjust the shoulder to lie in the same transverse plane in a position of forward rotation. So here is the example of upright AP oblique chest in LPO position. So as you can see here, the the structure shows the AP oblique chest LPO position in a radiographic image. So this radiograph presents an AP oblique projection of the thoracic viscera similar to the corresponding PA oblique projection. An RPO position is comparable to an Lao position. However, the long field of the elevated side usually appears shorter because of magnification of the diaphragm. The heart and the great vessels also cast magnified shadows as a result of being farther from the IR. So in this radiographic image, we need to um, clearly demonstrate the the following. Like for the both lungs, we need to demonstrate the entirety, and for the trachea filled with air, it must be seen here. Then the visible identification markers and the lung fields and the mediastinal structure must be seen. Then maximum area of the left lung on the LPO here, and the maximum area of the right lung on the RPO. So here we can see the right lung here, the magnified trachea, the left bronchus, the carina here, the vertebral column, the magnified heart, and left lung and the diaphragm, as you can see here, then the right claustrophonic angle. So I think this is the last part of my report. Then thank you guys for listening, and if you guys have any questions, you can just ask Sir Carl. And just uh, kidding aside, so I'll just send this PPT or I'll just email this to you guys. Pero I'll just edit it first kaya na yung mga part na kulang og letters nan. I hope you guys um, enjoyed my report, and I think that's all. So thank you, everyone.